Petra Thaler was diagnosed with cancer in 2015. Several malignant tumours were found in her breast, but the 58-year-old didn't panic.
I said, I don't have to fight against this disease. I will survive.
Her test results are promising, suggesting she has indeed beaten cancer. Her best weapon to survive the extremely draining therapy was exercise in the great outdoors.
I love it to be outdoors because the inspiration outdoors is amazing. That's life. Life is not indoors, life is outdoors. And your immune system is stimulated by being outdoors.
While still undergoing treatment, Petra formed an organisation called Outdoor Against Cancer in order to share her knowledge with other patients. Petra now runs training groups in 5 European countries. She encourages cancer sufferers to exercise in the open air, whether here in the Austrian Alps or in a city park after work.
Okay, let's start.
All these women developed cancer a few years ago. Petra Thaler started working with them while they were undergoing treatment.
They started to do sports and they never stopped doing sports. They are healthy, funny, mental strong. That's really, for me, it's an amazing thing. 5, 4, 3, 2, 1.
It gives me incredible strength. I drag myself here every time after work because I know others are here too. And I follow their example when it feels like I can't go on. I think, if they can do it, so can I.
Sports therapy has benefited them all. Sports alone does not kill cancer cells, but it could help in the fight against the disease.
Well, the World Health Organization says that the number of people suffering from cancer is likely to rise sharply in the coming years. The warning is included in a report that the organization has released for World Cancer Day. The good news is that more research, better treatment, and programs to prevent cancer could help save lives over the next decade. Cancer killed an estimated 9.6 million people in 2018. Only heart disease causes more deaths. The most frequently diagnosed forms of cancer are lung cancer and breast cancer, each responsible for just under 12% of all cases. They're followed by colorectal cancers at around 10%. And smoking tobacco tops the list of preventable causes of cancer deaths. It is followed by an unhealthy diet, obesity, and lack of exercise. And joining us now from Geneva is the World Health Organization's Dr. Andre Ilbawi. Welcome to the program, and thank you so much for joining us. There have been great strides in preventing and treating cancer, as we've heard, but the WHO report, it warns of a spike in the number of cases, saying that we can expect a 60% rise in the next 2 decades. Why is that forecast so high?
Yeah, thanks, Sarah. The cancer burden we know will grow in high-income countries. And this report shows that it is also going to increase significantly in low and middle-income countries. As governments are now more effectively treating traditional challenges, infectious diseases, maternal deaths, we know that people will be exposed to the chronic risk factors that will increase the likelihood that they will develop cancer perhaps in their 40s, 50s, and 60s. So what this report shows is that, in fact, governments in low and middle-income countries will see an 80% increase or greater. This is an urgent call for a global response to the cancer burden, to set priorities and to invest wisely to prevent and to control cancer cases everywhere.
Let's talk about one of those priorities, which is, survival after diagnosis, because it appears as if there's a lot of inequality in who survives, especially between developed and developing nations. What do we need to do to narrow that disparity?
Yeah, that's absolutely right, Sarah. Now, we know that progress has been made in high-income countries. There has been incredible innovation, research, and investments in cancer control in high-income countries. But we know both within high-income countries, the poorer communities, and developing countries have not had access to those innovations. To set the global agenda, we have to make decisions as to what are the most impactful and effective treatment and prevention options. In that regard, for example, we see that within the WHO, we've called for the elimination of cervical cancer as a public health problem. This could be a major achievement, and it's achievable in the next 5 to 8 decades, so before 2100. That means cancers like cervical cancer can be wiped out entirely. Now, to do that, we have to focus on pillars of action: prevention, early detection, and treatment. We will need action in all those domains. For example, HPV vaccination, detecting cancer early or screening to prevent cancer from starting, cervical cancer screening, and then building capacity in treatment. Because there will be many women, there will be many individuals who will develop cancer even in the best situations of prevention. In fact, in the next decade alone, we know that 200 million people will be diagnosed with cancer and will require treatment. So we must focus on building capacity. That is, how do we establish a stronger set of workforce? How do we build cancer centers? And doing that will ensure that that divide you're mentioning can be narrowed.
And in that pillar of prevention that you have mentioned, the report also focuses on the importance of exercise to fight cancer. Why is it so effective?
Yeah, that is, in fact, one of the increasing risk factors that we have to consider as we look at the next 1 to 2 decades. Obesity and a lack of physical activity will, in fact, increase the cancer burden for high-income countries, but also for low- and middle-income countries. In the past 15 years, effectively every country in the world has seen an increase in obesity. And obesity is a major risk factor for cancer. So physical activity and healthy diet is an important pillar for prevention, as you're saying, but in fact, it's also an important pillar for people who are actively receiving cancer treatment and also for cancer survivors. We know that cancer survivors who are able to be physically active, maintain a healthy body weight, are in fact at lower risk for their cancer coming back and at lower risk for developing a second type of cancer.
Dr. Andre Ilbawi from the World Health Organization in Geneva, thank you. Hair loss as the result of cancer can be devastating and is often cited as the single worst side effect of treating the disease. A unique Pakistani organization, Hair to Help, encourages women to donate their hair for wigs, and then those wigs are given to cancer patients. But it turns out that it took a fatwa for that to happen. DW explains from Lahore.
Since being diagnosed with breast cancer, Naghmana Dilshad has faced many challenges. After several rounds of chemotherapy, the 52-year-old wasn't prepared for the side effects of her treatment.
When my hair fell out, I cried a lot. It was very long and beautiful. I asked my mom if it would come back. My hair has now regrown, but it's not like it was before. This is a devastating loss. But we believe everything is a test from God.
Over the last 25 years, Pakistan has witnessed a significant rise in the number of people diagnosed with cancer. According to the World Health Organization, 174,000 cases were recorded in 2018. 20% of those were women with breast cancer. But years of underinvestment in the healthcare system is highlighting the country's inability to tackle growing health crisis. And with aftercare and afterthought, it is often left to charities to help patients feel like themselves again. Hair to Help is one such organization. Members of the public donate their hair, which is then turned into wigs and given to those in hospital wards free of charge. Initial resistance from some people to the initiative forced the charity to get an Islamic scholar to issue a fatwa in favor of people donating hair.
People still believe that this is a sin, especially if the hair they donate is misused. But I assure them we have nothing to do with black magic. I encourage donors by telling them that their hair will grow back, and that for women who are going through this trauma, these wigs can be a huge boost to their self-esteem.
Human hair can be colored, styled, and looks more natural, which is why it is preferred over synthetic wigs. But they are more expensive to make, so the charity offers donors free haircuts as an incentive to come forward.
Cancer patients go through a difficult time fighting this disease, and then they suffer from hair loss, and hair is important to the overall appearance of a woman in Pakistan. As citizens, it's our duty to encourage those in need.
And for donors like Suman, they know this small gesture can make a big difference to women recovering from cancer.